say that if there's one topic where you find a lot of energy, a lot of enthusiasm, a lot of drive, and a lot of emotion, it's in cancer. And we have a lot of people here who are, you could perceive the total commitment that exists. One of the things that we also want to discuss at this stakeholder meeting is also the coordination, the coordinating mechanism, and that's part of what is going to be presented and discussed at this right now. How do we coordinate actions? How do we all work together so that we don't trip over each other and so that we make it a seamless referral system for the patient? Because at the end of the day, it's all about the patient and the person who is afflicted by cancer. So how do we work together to ensure that they have an easier access to the type of services? As well as we want to, prevention is better than cure. So we also want to focus a lot of attention on identifying what are the risk factors at the community level, start a public education campaign so that people know what are the factors that bring you to that, and then start early screening programs so that the earlier you get them, the less effects and the more probability for survival. Big challenge include, for example, having a very clear, enough data. Because part of the discussion that we had in there was when people are diagnosed, or at least there's a presumptive diagnosis of cancer, people panic, number one, and a lot of times they don't know where to go. And then that information does not enter the system, so we don't have a very clear picture of what the real situation is in the country. We know, and sometimes from information abroad, that, well, of course, information locally, but a lot of complete information from abroad on studies being done, that some of the prevalent cancers are prostatic, breast, which is the same almost everywhere else. So we're saying, all right, let's look at those particular, and let's look from the bottom up, from prevention, identification of risk factors, to early screening, and then access to care. And right now, one of the biggest challenges is how do you access treatment for people who have already been identified very late, or have been identified with a disease already. That is a major challenge. That is also a very costly service. And so we're looking at alternatives right now.